Hey there, this is Dr. Evan Osar with Institute for Integrative Health and Fitness Education. Welcome to Facebook Live Session 2. So each day for the next 30 days, Monday through Friday I should say, we're doing Facebook Live. So instead of the Integrative Movement Insider newsletter that we send out twice a month, we're doing Facebook Live. So in this session of Facebook Live, we're going to cover some of the principles around, or concepts I should say, around training the older adults. Because if you work with older adults like we do here in our clinic, then you know that they present to us with things like chronic tightness and or discomfort and or loss of ability to do the things they need to, want to, and or love to do. In yesterday's Facebook Live session, we talked about the integrative movement system process that we take our clients and patients through here in our office. One of the key concepts or key phases of this program and process really are, number one, the discovery phase, so that we understand our client's story. What are they coming to us with? What's their medical history? What are the things they want to do and or like to do and or can't do? And most importantly, what are our clients' functional goals? What are those things they really want to do? Because then that drives our assessment process. So what assessments we look at are driven by what we hear in the history and ultimately what their functional goals are. Because that will then lead us into the IMS corrective exercise strategy. The exercises, the release patterns, the activation patterns, the cues that we use to help our clients ultimately address the things we found during their assessments, which then works us into phase 3, because then we take the release, the activation, and the education from the IMS corrective exercise strategy into the fundamental movement patterns. So we teach our clients how to better squat, lunge, bend, rotate, push, pull, gait, balance, and carry patterns, because those are the patterns that we believe that most individuals need for competence in everyday life, and ultimately then to start working them back towards their functional goals. Now we're going to address a very common issue that many of our clients present to us with, and that's osteoarthritis. So what exactly is osteoarthritis? And what is this process that we hear so much about? So as we know, osteo means bone, right? So that's bone, and arthritis means inflammation. So how does your client's doctor or physician determine whether they have osteoarthritis or not? Well, they take an x-ray and they see things like bone spurs and decreased joint space, lack of cartilage space where the cartilage should be, space in the joint on the x-ray. And then they say, oh, you have osteoarthritis, and that's why you have pain or just tightness or dysfunction. And all of that could be absolutely true. Now, most of our clients are told also that it's hereditary or genetics. And while every issue that our clients are presenting to us with, so whether it be diabetes or heart disease or obesity or things like cancer and or even things like osteoarthritis, they all have a genetic component. But here's what I want you to really understand, and this is really where we come in as health and fitness professionals to help our clients the most effectively, is to understand that this process specifically, or all these conditions, have a genetic component. But more importantly, it's the habits or our client's lifestyle that will drive these issues to a higher or more significant level. Of course, there's cancers and heart diseases and diabetes and things like that, type 1 diabetes and rheumatoid arthritis that are genetic and or inflammatory type conditions that people are born with. Absolutely. But the large majority of our clients' issues, the clients that we're seeing in our clinics, are these issues are developed by their habits and or their lifestyle. Their lifestyle is basically just a series of their habits. So what are the habits that our clients have? We'll turn our attention now to osteoarthritis. What are the habits our clients have that now relate to why they have osteoarthritis? Well, here's how it starts. And it's really a 3-step process. First, they have their posture and movement habits. And these are the things that they do throughout their life. Now you're like, why? I don't have any certain habits. Yeah, we all have habits. All of us have habits. Think about your drive to work this morning or your last drive, especially if you're going to a place that you're familiar with, that you go maybe 5 times a week, 6 times a week. Did you really have to think about it a lot, or you were thinking about a million different things in your head as you're driving in? And sometimes you get to your office or your destination, you're like, I don't even remember driving here, because that was your habitual patterns that kicked in, so you didn't have to overprocess or overthink it. Well, our clients also have these habits around posture and movement. So here's an example with myself and my wife, 2 different examples. When I was a kid, I was depressed. So I walked around like this all the time. My mother was always telling me, stand up straight, bring your shoulder blades back. And because I was so I was so controversial and I wanted to be so like radical, I said, no, I'm not gonna have good posture. So I walked even more like slumped over. So that became a lot of my habits, and I took that into when I started lifting weights, and then I started to develop shoulder problems. One reason why I started to develop shoulder problems. My wife, conversely, when she was a little girl, was told by her mother to stand up straight, to pull her shoulder blades down and back, to squeeze her butt and tuck under. Her posture, completely different. Her spine is completely extended. Actually, when I first met her, it was overextended. Her pelvis was stuck in a posterior pelvic tilt, significant posterior pelvic tilt. She was braced down so much with her abs because this is the message she heard from her mother from the time she was small. So we all get these messages about posture. Even if they're not verbalized like our parents did to Janice and I, some of us had our coaches, parents, friends, family, our physical therapists and our chiropractors we may have seen early on. So they've all influenced our posture, and then we've also observed posture. There's a great video somebody told me about on the internet about a wounded soldier walking with his son. And his son, the soldier, has a limp from his injuries from the war, and he walks with a limp. And the son, who's 3 to 5 years old, he also walks with the same limp because he's emulating what he sees his father doing. So we've all been influenced by things we've seen, been told, and or taken into our bodies through our emotions, through different things through our life. So all those things direct our habits. Things like having babies, traumas, surgery, significant broken bones, sprained ankles, any type of abdominal, low back surgeries, hip surgeries, knee surgeries, all create compensations. Some people compensate very well, others don't, and that all drives our habits. Because then here's what happens then. Now we get these posture and movement habits. Then they start to create soft tissue injuries or soft tissue issues. What are soft tissue injuries? So those are your sprains, your strains. You start to degenerate your cartilage a little bit. You start to have things like labral tears, meniscus tears, things like that. So these non-optimal habits up here start driving soft tissue reactions. You may have hypertonicity in certain muscles. You may have increased ligament density in certain areas to help protect the area. And ultimately, over time, then this starts to lead to bony changes. And that's what you start to see when you go to your doctor, or when your client goes to their doctor and they're diagnosed with this condition called osteoarthritis. It isn't because they just woke up one day with it. It's been a lifetime of posture and movement habits related to all these habits we talked about early on that started to create this condition known as osteoarthritis. So what can we do? What can you do as a health and fitness professional? You start here. You start by identifying and changing their habits. And that's where the assessments come in. Because then in our corrective exercises, we're going to address those non-optimal habits that we find in our clients through their assessment. Do they need more range of motion? Do they need to stop gripping? Do they need to have some kind of activation? Do they need a better cue? Do they need more awareness? That's all part of our corrective exercise strategy. So tomorrow, we're going to look at a very simple and easy assessment we do for our clients that have osteoarthritis of the spine. And then the following day, so that'd be Thursday. So on Thursday, then I'll show you a very simple corrective exercise pattern we use with our clients that have osteoarthritis of the spine. And then Friday, we'll take you into the integration phase. How do we take the corrective exercise strategy into a corrective exercise pattern, or I should say a fundamental movement pattern for the core that will help our clients start to function, feel better, function better, and ultimately get them back to doing the things they need to, want to, and love to do. This is Dr. Evan Osar. Thanks for watching. Thanks for being part of our Facebook Live mission, or sessions, I should say. And we look forward to seeing you tomorrow morning. And watch our newsletter also, Integrative Movement Insider. You can go to our website, iihfe.com, sign up for our newsletter so you get updates as to when we're doing Facebook Live, because the times will change depending on the day. So thanks for watching. Have a great day. We'll see you tomorrow morning and talk more about this condition, osteoarthritis, and how you can be the solution that your clients need, want, and will seek out. Take care.